So come on in. We are going to spend about the next hour and a half or hour and 45 minutes together. We're a very informal group, so we're hoping there's lots of discussion and interaction. I'll introduce, we have two speakers. First, we have Shelley Nobles, who's a physical therapist, works with pediatrics, works with kids for about the last 7 years, went to Texas Lutheran and then got her physical therapy degree at University of Texas Medical Branch and now works at Dell Children's Hospital. So we'll be hearing from her, and then she's going to open it up with questions and discussion for you. And then we're going to hear from Stephanie Corey, who is a registered dietitian here in Austin, especially for children. And she works in a specialty clinic, outpatient setting, where she sees rheumatology families, including many JM families. So she has a great wealth of information there. She also works with the dermatology, gastroenterology, infectious disease, nephrology, and allergy clinic. So she's a wealth of information. And as a lot of us know, that JM kids sometimes don't just have JM, and so she's got that expertise to help cover some of those other areas. So I'm going to open it up and start with Shelley.
All right, good afternoon. Julie has some handouts that she's going to pass around to everybody. So first, I just kind of want to get an idea. Who here has kiddos with JM? Everybody? Is this everybody with kids? Okay. And whose kids have been in physical therapy before? Okay, good. So a good portion. So you already kind of have an idea of the importance of therapy. So I just kind of wanted to give a background. For physical therapy, it's important to get JM kiddos in and started with therapy as soon as possible. With inflammation and new diagnosis, we like to start off with gentle stretching. And then once the inflammation is controlled with the medication is when we really start some more aggressive with the physical therapy. But the most important thing is just staying active. So I'm passing around some handouts. I just printed off some basic kind of exercises to get started. If you've never been in therapy before, or maybe you have and you lost your exercise sheet that your therapist gave for you, you have some ideas of exercises. These are pretty basic, some basic stretches and strengthening for your arms and for your legs as well. Most of these exercises are working those proximal and core muscle groups, which we know to be the weakest with the JM population. I've kind of put on here that stretches should always be done and they should be comfortable. They shouldn't be painful. There's no extra gain with the pain. We want it to be comfortable. We don't want to overstretch and cause any new or extra muscle damage. So that's why we want them to be comfortable. And with strengthening exercises, one of the things that's most important is that we're working within comfort as well, not overdoing it and not over fatiguing the muscles. What I tell a lot of my patients is that they are self-limiting with their exercises and with their activity. So at school or recreational sports, I tell you, you need to self-limit yourself. So if we're out and we're playing a soccer game and you feel like you can go a full quarter of soccer, that's fine, but maybe you need to sit out the rest of it and kind of working with your parents, working with your coaches, and knowing kind of when to self-limit and how to self-limit and when you should stop and take a rest break. If you have a younger child who doesn't understand self-limiting, that's where it's very important for the parents to talk with the coaches, with the PE teachers, with teachers at school about kind of how to recognize when maybe the child needs to self-limit. Maybe we're at recess and we notice, oh, he's slowing down a little bit or tripping and stumbling, then that may be a clue to go to that child and pull them over and say, it's time to take a break. Here's a sit-down activity that we can kind of do. Same thing with coaches during recreational sports to kind of understand when they need to limit themselves, because we know the little ones can just play, and they don't really know or understand self-limiting. With that being said, I also encourage talking to your child, even no matter how young they are, and really opening that conversation and communication with them about why we're self-limiting. I'm very much an advocate of telling your child why I'm doing what I'm doing rather than just saying, you need to do this, but explaining it to them, explaining to them the diagnosis and why we're doing these things so that they can start to learn and understand that and recognize it. So I think everybody has their handouts now. If you want to take a look at them, if anybody has any specific questions about them, I can demonstrate anything for you. If there's anything that you see on there that you're not familiar with or you're not sure why we might do an exercise like this, I can help explain it to you. They all have a description of how to do the exercise. They have a picture of it, and then just some basic sets and repetitions to do. With those sets and repetitions that are listed there, again, with the self-limiting, if you're trying to do these and implement these, maybe one set of 10 is enough. We get really fatigued, then we're not going to go on with that. We'll progress later with it. Another thing about PT, one of the things that we do in therapy when you first come, we'll do our initial eval, and one of the ways we kind of monitor progress with strength, the muscle strength, muscle endurance, and the muscle function is we do the childhood myositis assessment scale. I don't know if anybody's had this performed with their child. I know PTs, I do it, some of my coworkers do it, and I've seen rheumatologists do it as well. But it's a way that we kind of monitor the muscle and how they're progressing with therapy. So we'll do it the first day they come. We might do it at a reevaluation. Maybe we notice, oh, your function is getting a lot better. Let's kind of see where you're going. And it kind of gives us some ideas of how to tailor your therapy program as well. Another thing we like to do with therapy is work a lot on functional strength. So practicing getting up off of the floor tends to be a big struggle, a hard one that's important to be able to do. And then also getting up from sitting in a chair, especially from sitting for a long time. We practice standing up from the chair as well. And then another really big one is practicing balance, standing on one leg. And I put that on the exercise sheet too. But those are kind of our big things with therapy. Another thing, has anybody had a child in occupational therapy? A couple. So I've had, of my patients, I've only had one do occupational therapy, and she had a lot of trouble with handwriting, is why we got into occupational therapy. You know, they did a lot of work on working those big proximal muscle groups as well to help with her handwriting. But that's another thing they look at is handwriting, and any dressing difficulties or feeding difficulties are a good kind of indicator that maybe we need to push for some occupational therapy as well as physical therapy. So I kind of want to open this up. That's kind of my big spiel. I'd like to know if y'all have any questions about exercise or activity.
Therapists exist.
Yes.
Then they can find.
Yes. It is readily available on the internet. Okay. Like if you go and search childhood myositis assessment scale, it will pull it up for you. And it pulls up not only the score sheet, but it also pulls up like the information on how to do it. Yes.
Is that something that we could do at home as parents?
It's pretty basic stuff, yes. Like it has, so I have it here if anybody wants to look at it afterwards, but it has stuff like being able to hold your head up when you're laying down on your back, raising your leg, rolling from your back to your belly, doing sit-ups, getting up off the floor, standing up from a chair, picking something up off the ground. It's pretty basic stuff. And the description sheet is like 10 pages of how to accurately do each item and how to score it. So yeah, probably. Any other questions? Exercise, activity? Right. So, my physical therapy background, we do what's called an episodic model of care, which might be similar to the therapy that she's coming from. And one of the things that we do, especially, you know, with a diagnosis that you might be managing for your lifetime, is we give you the tools to go forward and do exercises on your own. We encourage activity in the community. I always provide some resources. Swimming is a great activity. But those are things that we do. We give a home program like this, get activities out in the community, and then say she has a flare, or we start to notice if she's really falling behind or she's having a little bit of a regression. That's when I would tell my patient, you need to come back and see me, and let's restart. Let's kind of review our exercises, and let's get set again. Do the same thing, send you with that stuff off, take a break. If it happens again, so that's what I guess is where your therapy is coming from as well. Any other questions? Okay. Well, I can turn it over to Stephanie. Thank you.
Hello. Oh, wow. I don't like my voice on microphones. All right. So my name is Stephanie Corey. Like they said earlier, so I work at Specially for Children. It's here in Austin. There's one rheumatologist there, Dr. Carrasco. Does anybody live here in town? Do you see them or him? Okay. He's cool. All right. So who all here has seen a dietitian before? Okay. Hopefully they were helpful to you. So generally the patients that I see in rheumatology clinic are severely underweight or severely overweight. Every once in a while I'll see a kid for some sort of vitamin deficiency or nutrient deficiency, but steroids or treatment of JM usually kind of makes kiddos toggle one way or the other. If I were to go see a patient, generally I would start with what type of diet are they doing right now. So just getting a good idea of where they are right now, what's their baseline, what are we working with, and where do we need to go. So getting a good idea, getting a plan set with the family, and then educating from there and working from there. So I hate to break it to you, but there's no fabulous diet. Oh, I have handouts. Oh, she's doing it, sorry. So there's no miracle diet that cures JM or things like that. So unfortunately, it's just a general healthy diet. I wish that there was research or that I had come up with something fabulous, but there's really not. It's different for everybody, and we'll go through a couple diets in a minute. They're on the handouts. But basically, how do you feed a child with JM? You feed them a normal balanced diet. What does that look like? We talked about physical activity earlier. So balancing physical activity with a healthy diet, a diet that is hopefully high in whole grains, vegetables, fruits, low in fat, cholesterol, and sodium and sugar. So we use something called, and you'll see it when you get your handout, the plate method. So it's choosemyplate.gov. Basically, it's a plate, and half of it is fruits and vegetables, and half of it is grains and protein with a dairy source. So that's what we would prefer our patients' plates to look like. It's very simple. It's very easy for elementary kiddos to follow up to, adults. When I did a little bit of time in adult land, and we did the plate method there too. So it's applicable to all ages, and it truly works. So whole grains, fruits and vegetables, because they're high in fiber. Fiber keeps you full for a longer period of time. So specifically for kiddos or patients that are overweight, it's good because it helps them to prevent from overeating or keeps them full for a longer period of time. Low in fat, saturated fat, and cholesterol, that's just good for everybody, not just patients with JM. So the best way to control fat and sodium cholesterol in the diet is preparation and how you cook things, and we'll talk about that a little bit later. Diet that's moderate in sugars. So sugar isn't good for anybody, let alone someone with JM. So the additional calories aren't necessary, and you're probably getting sugar from a lot of other things. anyway, so I encourage real foods, so people eating whole, real foods, so whole fruits and vegetables, not processed type of things. Foods that are low in, like, not processed, so not highly processed, so deli meats, hot dogs, sausage, bacon, things like that, you know, that are really highly processed and have a lot of chemicals and preservatives in there. So the better you can control your diet on the front end of things, the better the better overall your health. So most of the patients that I see are on some sort of steroids or have been on some sort of dosing of steroids. So steroids do all sorts of things, and they have side effects like increasing your appetite, which might cause weight gain. It increases your blood sugar, puts you at a higher risk for developing osteoporosis. It inhibits the absorption of calcium and vitamin D, or your body's ability to use vitamin D and calcium. So we need to make sure that our kiddos are getting enough of that, because they're growing and they need to, be able to move and develop properly. So we pull labs a lot and make sure that everybody's levels are looking good. It also causes sometimes steroid-induced diabetes, so that's where the sugar portion comes in, and exercise as well. So it's kind of all working together and things. So eating a balanced, healthy diet, something that's low in salt, high in calcium, vitamin D, and that second page, I think I gave you guys, just foods that are high in calcium and vitamin D. So that's the biggest thing that I talk to kiddos about, is making sure that we're getting enough of that in their diet. You do need both calcium and vitamin D together for bone developing. You can't just eat a bunch of calcium and not have vitamin D, and you can't do the other way around. So they need each other to form bones and to be absorbed by your body. So there's the recommendations right there for the age group for each of those, and then sources in that table below. So you'll see a lot of the sources are dairy. Obviously, everybody I think knows that, for calcium, and then these days it's fortified with vitamin D. And then there's a couple vegetables and fish that have calcium and vitamin D as well. So a big question that I get is, are there any special diets? What about gluten-free? What about, this or that? So there hasn't been very much research, unfortunately, on juvenile or JM. So nobody really wants to test kids. And so there isn't a lot of research out there right now. They're starting to do some. So they've done studies on vegetarian diet that basically it works because it's low in fat. So if you're not eating a lot of the processed meats and bacons and things like that, obviously your diet's going to be lower in fat right off the bat. So so that's found to be helpful for some kiddos. Gluten-free, it's such a touchy subject. So sometimes it helps, sometimes it doesn't. JM being an autoimmune disorder, it automatically, the chances of you developing another autoimmune disorder are a little bit higher. So because celiac disease is an autoimmune, sometimes they're seen together. Not always, not saying that you're going to develop celiac disease or whatever, but sometimes certain foods that are high in wheat or gluten do cause inflammation. So Mediterranean diet is also something that's been tested in adult community or adult land, and that's similar reasoning behind the vegetarian diet, but with the addition of they do a lot of fish, and so fish is high in omega-3, which has been found to help inflammation, which is also something that I recommend occasionally if my patients' triglyceride levels or their lipid panels are high. So it's omega-3 has been found to help with that or help bring down those lipid levels if they're high. I have some healthy snack ideas down there. That's usually something that I get asked a lot. Not all of these are exactly what I would prefer, but they're things that kids eat. So your best bet is some sort of protein with something else. Protein because it also helps you stay full for a longer period of time, but a lot of these things. So fresh fruit, vegetables, ants on a log, celery with peanut butter, yogurt, things like that. So tips at home. So like I said earlier, the best way to control fat in your diet is how you cook or prepare things. So my example that I love to give in the clinic is you can take 2 potatoes. You can take a potato and you can bake it. And so, you haven't added anything to it. You haven't altered the fat or the calories in any way, but it's cooked and it's ready, right? And so you can take that same potato and you can chop it up and fry it. And you've also cooked it, but now the oil has been absorbed by the potato and then you eat it. So you've cooked both of those potatoes. You haven't increased the calories by baking it, but you have by frying it. So baking, broiling, roasting, grilling, those are your best bets. Obviously, try to avoid deep frying. Trimming the visible fat off of your meats using, the leanest ground beef you can, or even switching to turkey. So also what I counsel my patients a lot about is just like the eating environment. What's the environment at home like when you guys are eating? Is it chaotic? Are people running around? Are you even at the table? Is the TV on? Do you sit in front of the TV and watch on the couch? And so when you do things like that, when the TV is on, when you're distracted, when you don't even sit at the table, chances are you're going to overeat. You don't pay attention to portions. You don't pay attention to how much you've eaten or actually enjoy it or chew your food or, any number of things. And so just being aware, drinking plenty of water before and after your meals is something else that I recommend to prevent from overeating for my bigger kiddos. That's basically it. That's a really condensed version of what I would usually do in a session. But does anybody have any questions? Okay.
Okay. So we are 8 years into our process of since we got diagnosed. 7 years we just did purely Western medicine and managed whatever symptoms we could with that, but we still dealt with a lot of fatigue issues and GI issues. And so then I added a naturopath to our team about 9 months ago, and we did this patient-specific elimination diet and found for us, or for her specifically, we are now cow-free of all beef and dairy and everything, and all processed meat-free. And her energy is normal. Her GI symptoms have completely resolved. So I'm hoping by coming here, one of my goals in coming to this whole conference is to encourage people to say, look at what how your kid reacts to things, because the whole inflammation in the gut, there is a lot of science, I think, behind relating gut health and immune system health, not necessarily dermatomyositis, but just immune system. And if your gut's healthier, then your immune system can fight more normally and not be so whack. And so I'm hoping to help people realize that food is a very important treatment. Yep. And people often don't think of it that way. And it really can make a difference in your kid's ability to be normal.
Mm-hmm. Absolutely. Yeah. So another clinic that I cover is GI. And so we've found for, certain like IBD, Crohn's type of disease states that we have had to kind of tweak diets and find what the trigger foods are for each kiddo. Generally, it's some sort of combination of dairy, processed foods, and some sort of carb problem. So that's not surprising to me that you guys are completely, milk-free or cow product-free and processed foods. Yeah, so that's something that, it's good for everybody, let alone your daughter. So, yeah. But there's no real way to know. Somebody else could do that same thing and follow your diet, and unfortunately, it may not work. So, I would recommend trying one thing at a time or eliminating one thing at a time. I wouldn't, go crazy and take out all these things, because it might work, but you don't know what it is, and you don't necessarily need to take out all of those. So the goal is to still eat a balanced diet and to get nutrients and vitamins from your food. Not that there's anything wrong with taking a multivitamin, but if you don't have to, why would you want to? So, anybody else?
You had mentioned to eat foods higher in omega-3 that would help with inflammations.
Right.
Are there any specific foods that cause bad inflammations, or like foods that we should stay away from that will give you more inflammation?
It's like I mentioned, it's not the same for everybody. Sometimes foods like foods that are high in gluten. Sometimes the nightshade vegetables, if you've ever heard of those, sometimes people say that it causes inflammation. Which ones are they? It's tomatoes. Oh man, I have to look that up. I don't remember it. If you Google Tom Brady, or whatever his name is, that quarterback, he follows that diet. He's a little extreme, but it's like tomatoes. I'm sorry, they're like completely losing my mind right now. It's all the good ones. It's just nightshade. If you Google nightshade vegetables, you can find them. But those are also things that have been found to be high in, like lycopene. Tomatoes are high in lycopene, and that's good for your heart. So, you can try eliminating them if you want, but that's what he thinks works. But I haven't had any patients that have eliminated those and found success. So. Hold on, the mic is coming. You're going to get a workout today.
Does anyone have any advice for making, I think my problem is that we both work full time, so I feel like sometimes we really do try to buy healthier foods, but it comes times where we come home and we say, let's order a pizza. Mm-hmm. Or, we don't want to cook. Mm-hmm. Or we cook something that's easy, like chicken nuggets, or something that's not great for the kids, but something that's easy after working. So does anyone have any meal prep ideas, or what do people do to keep, it takes a lot of time to eat healthy, right? So anyone have any ideas?
I have a few. I work full time too. I do a lot of crock pot meals so that you can do it where it can sit all day. Or whenever I do cook, I'll cook extra and freeze it in individual containers for her in the freezer. And Kaya also has to take her own meals for school every day. And because she's on a restricted hypertriglyceridemia diet, she has to eat pretty healthy. And so that's helped me. The individual containers, you can order them on Amazon. Mm-hmm. Just put them in there already frozen so they have a choice to pull it out. So even if you want to eat something fast or you want to have a pizza night, they can still eat healthy. And then, like I said, the crock pot is a very good thing. And even if you grill an extra hamburger or grill an extra chicken breast or something like that, you can freeze it and they stay frozen well. Individually freeze them and then put them together in a Ziploc bag, and you can do that for them. That's worked for her.
That's pretty much what I have recommended. Yeah. I think, didn't someone over here have it? No? Did I make that up? Oh, okay, good. Yeah.
One thing that I've noticed as a parent, busy parent as well, is I've learned from watching the chefs on TV. You know how they just whip things together and it's all so fast? Mm-hmm. They've got everything pre-cut.
Yeah.
And so I find on the Sunday or the time when I am cutting vegetables, I just cut them all at once. and then they're all in there. Even the chicken, even if I only need 2 chicken breasts, I'm just getting it all cut up, all ready, and they're all in individual containers, so you can throw it in that crock pot, or you can throw it in that stir fry, and you're done.
Yeah, absolutely. Meal prep Sundays, people like to do that, so.
Then for people who don't meal prep, easiest thing I found is you can buy, I mean, it's not the healthiest, but it's better than like chicken nuggets. You can buy the frozen chicken strips, and you can just warm them up. And buying a pre-made veggie tray and keeping it in your fridge, you just pull it out, and it's like an automatic snack. You can eat it during the week. So that's for lazier parents who don't want to cut up the vegetables, but it's easy and it's there.
Yeah.
And so those are the 2 easiest things for me to do.
Yeah. So, having frozen vegetables in your freezer, most of the time they're equally as nutritious as fresh. They're flash frozen right when they're picked, and so, nutrition-wise, they're fine. So having that, it's really easy to, pour some out, warm them up, or defrost them, and then have something paired with that. So cutting or having things pre-cut or doing it all at once is great. It saves a lot of time throughout the rest of the week. So, although, I mean, not that pizza night, that's fine every once in a while. So I don't guilt people. It's, it's okay. Anybody else? Oh man, we whizzed through that.
Hello? Is there anyone dealing with sodium restrictions, steroids? Everyone could be at different phases.
Sodium. Do you feel pretty comfortable knowing what foods are high in sodium? Okay. Yeah. Yeah. Mrs. Dash is awesome. Yeah. Mrs. Dash, lemon, lime, any pepper. So basically foods that are high in sodium are anything processed. So I like to give the example of the store. Hopefully most people shop at H-E-B. So, when you first walk in, there's the produce and, fruits and vegetables. Those are all fine. There's virtually no sodium in fruits and vegetables. Dairy, there's a little bit in there, but not a whole lot of added. And then just plain meats most of the time are going to be fine. The problems is when you start to get into the processed foods, so bacon, sausage, things like that, and then the things in the middle of the store, so in the shelves. So sodium or salt is a preservative, and so they put it in foods to help them stay longer or fresh for a longer period of time. Manufacturers do that. So things that are in the middle of the store are generally going to be higher in sodium. So chips, cookies, cakes, crackers, canned foods are very high in sodium. So just watch out for those. But, sometimes you can eat virtually no sodium and still have high levels. So steroids are really good at messing with labs.
One thing that I will give a tip out there, some of you probably already have it, but there's a device called a YoNana. It's cheap. It's not very expensive. You freeze your fruit and you run it through it after it thaws about 5 minutes. It was made originally for bananas. We run pineapple through it, and it turns it almost into the texture of ice cream. And it is wonderful, and the kids love it, and it's a great treat. It doesn't take long. They can even do it themselves. You can add a spoonful of peanut butter in with it. It'll go right through it too, so you can give them a little bit of protein if they need that or something.
Nice.
It's called a YoNana, Y-O-N-A-N-A.
YoNana?
YoNana. Cool. You freeze them if your bananas get a little bit with black spots or whatever, you can peel them and freeze them. Peel them first. I learned that. And then freeze them. And then you let them thaw about 5 minutes, and then you run it through. It is a great treat. We've ran strawberries through, pineapples. We've tried everything. We tried some frozen grapes. They weren't the greatest, but we really have tried. They like to mix their banana and their pineapple. My girls love it. They don't even want homemade ice cream anymore or anything.
That's great.
The other thing we were talking about is J.C. Potter's makes a light sausage. It's like less than half the calories. It's a whole lot less fat. It really does do good on that. And then,
what's the brand?
J.C. Potter.
J.C. Potter?
And it's called Light Sausage, which Kai is a big sausage person, so we were looking for a treat every now and then on that. But those are two things that we've really
That's great.
Tried with her. And then a turkey bacon with the egg beaters. And then put them on like the whole grain sandwich then for a great breakfast that's got a little good protein and a little bit of the carbs.
A little carbs,
And then you can fix them I fixed 10 or 12.
Yeah.
Put them in individual Ziploc bags, and she can microwave them for 45 seconds in the morning, and they're ready. So those are a few helpful tips for getting around. But and I will say on her, she had no problems during any of the treatments, no problems during anything, went to remission, and then last year developed hypertriglyceridemia. So just because it's going good now, I mean, that's why they watch the heart health for the whole time, is because it can, and that's all hers is purely that. And it's not a matter of necessarily eating very unhealthy. Oh, the black bean brownies, that's the other thing.
Oh, yeah.
The kids like them. And if you're like me, you'll cringe your nose up.
Oh, it's weird. But
black bean brownies.
Yeah.
And they are wonderful. Google a recipe.
They're good. Yeah.
and I can give you guys a recipe, but there really is a good recipe, and they are wonderful. My whole family likes them now.
Yeah.
So,
or avocados. I know people put avocados in brownies sometimes too.
Okay, so I have one quick question. How many people here are trying the cow-free in terms of dairy-free, whatever? I know you are. Anyone else trying cow-free? No? Okay. We're not fully there. But a good dessert option, if you are cow-free, is doing something like a coconut milk or an almond milk mixed with chia seeds, and then you can throw some fruit in there, whatever you want. And we use honey, and then if you stir it up and put it in the refrigerator for 4 hours, it turns into like a pudding, and it's really great. Like it's fantastic. So you do that,
Chia seeds are really good for you too. So good job.
Good tip. On that line, the avocado yogurt or pudding. Have you heard of that one? The chocolate avocado pudding. Yep.
Yeah.
Just Google that. Great recipe.
So this question is kind of for everybody else here. When our son was diagnosed, we were convinced that he had an allergy at first because we were told by the doctors that it's not typical for the rash to come and go, but his did every time he ate certain foods. So I was convinced, and we were both convinced, that he had an allergy to processed foods. And we would write it down like frozen pizza. His face within minutes of eating it would flare up. A granola bar did it. Some goldfish crackers. Like, we noticed it was anything processed. So I was convinced it was a preservative in one of the foods. So talking about avoiding foods with, processed foods, I was just wondering if anyone else had that happen with their kids, or if we're just one of the few. He doesn't react to those foods now. He did then. We've lightened up with it. So I don't know. No one's really given us an answer, and I was convinced he was allergic. I don't even know.
It's a blood. I mean, anybody can order it. GI, PCP.
Stephanie, do you want to address that allergy versus sensitivity issue? In terms of the testing and the reliability and all of that. It's a big issue.
That is a very big issue. So I look at research, and I generally, what I've read and what the information is out there is that you either can tolerate things or you cannot. Although I swear there are people that are really gung-ho about just, being sensitive to things. I don't know. There could be other things going on. I've read an article that said there is no such thing as gluten sensitivity. So you're either allergic or you're not. And if you're not allergic, there's no point for you to eliminate gluten from your diet. But there are other factors, and there's medications and disease states and things. So, your best bet, you can get tested if you can. You might get results that are inconclusive or negative, falsely or otherwise, but it's pretty much trial and error. So, you know, eliminating milk or eliminating processed foods and seeing. But there's no, I can't really give a great answer on that, so sorry. Anybody else? Or for Shelley?
I just wanted to say to you.
Drag you over here again.
Yeah, I know, right here, right. We had a different kind of reaction to a different thing early on in my daughter's disease state, and then so for her, we noticed she had a problem when she would get in a swimming pool with chlorine. And so we tried to eliminate all the chlorine from our house, and we just thought it was this chlorine allergy. And then once we got her immune system sort of regulated, she was fine around chlorine. So it was like her body was hypersensitive, and it reacted to other weird things. And then once she got regulated, she was fine. So I'm just wondering if yours was sort of that similar situation where when the body's completely out of whack, it reacts to different strange...
Sun, yeah.
We put black on him in the winter because the UV lights in our house caused his rash to come out. And now that, 3 years into it, he doesn't react. We still put sunblock on him when we're outside, but I'm not crazy about it because it doesn't react like he did. So, yeah, something. I just want to know what. I don't know why. I just like to understand things.
Stephanie, you mentioned mealtime and how sometimes, well, all the time with families, people are coming and going, and it can be a very chaotic time. I'm curious with your families how mealtime is going. We have a lot of behavioral things with our children as well that some typical families may not experience, and so that bleeds into our mealtime and can disrupt that. Just curious how mealtime's going, and also on the side of if any of you are making dietary changes with your child or your family, how is that going? How is the child accepting those changes? Are they receptive? Are they angry? Are they any thoughts on that?
She's chuckling. She has something to say.
I was sharing with Julie earlier, Kaya was very angry at first. She said just, when one thing gets going good, something else happens, and that's kind of their thing. And so our focus of it was we didn't just make her eat differently, we all ate differently.
That's great.
Which I think in the home is probably the best thing for everybody. And that's what Dr. Pogman was discussing with us, because even we lost weight and he lost weight, and it benefited all of us, and his blood pressure went down and everything overall. But, good days and bad days, they're all going to have it. One benefit, Kaya, she goes to school every day. They don't have a lunchroom, so everybody takes their lunches, so she's not different. But, making them as much, and then also that they're not just taking something boring every day. Like her friends think she has the coolest meals because they're home-cooked meals. I mean, like your mom loves you because she cooks for you every day. No, her mom loves her because she puts it in the freezer. But, I mean, those are the things that sometimes even make them feel special because they do have something different or something specially cooked or something not just in. So those are the ways we try to help make her feel a little bit special. And then, of course, there's always those days that they can just have what they want to have. But, of course, at first she was very resentful, and if she couldn't have what she wanted, she just wasn't going to eat. And so, I mean, that's just a natural reaction. She's 10, or she was 9 at the time, and so that was her natural thing. And so I think that's ordinary for them, but to let them even out of, these are your choices, now you can choose. Not you can choose from the whole store, but here's your choices, now you choose. You help me. So like I do, I try to on Fridays say, what would you like for the next week? What are some meals you would like to have that you know you can have? To let her tell me so I can get my stuff to meal prep for either the weekend or for the week. And so let her help me make some of those plans so then we can say what night do you want them so you can have the leftovers, or which one would you like to have for the school for the leftovers. So those are some ideas on that. So.
That's really great. Yeah, it's generally a control thing. You get diagnosed with something and you get you can't have this, and you're like, what can I have? So, just having all of those things taken away from you. So, giving them, I don't know your name. What's your name? Kaylee. Okay. So what Kaylee was saying is exactly what I would say to someone that would ask me that. Give them as much control as possible. So give them options, include them in the conversation, include them in meal prep if you can, or cooking, just to get them engaged. Generally, if they're engaged and they're participating in the cooking process or the meal prep, most likely they're going to eat it or, want to eat it. So those are all really great recommendations or tips. So good job. Oh, we got another one.
So my daughter's 14, so she's in this whole social scene of, going to her friends' houses, and every single time it's pizza, and what can she do? And so we're trying to, as we modify our diet at home and eat along with her restrictions, when we go out, then it becomes a stressful moment. Oh my gosh, what do we do? And this is all sort of still new for us. So we're having conversations ahead of time to say, okay, so if we go to an Italian restaurant, what can you eat ahead of time so you don't get flustered at the menu and think, I can't eat anything at an Italian restaurant. That's not, but actually you can. You just have to find a place that'll accommodate and then come up with a plan ahead of time. So she knows if she's going out for pizza, she knows what she gets. And she's fine with it and she's happy with it. So planning ahead of time, and also when she goes to friends' houses, takes her own food. And she can share it because she doesn't want to seem greedy or whatever, but share it, but also always having to come prepared so she doesn't have to look at all the choices and think, I can't eat anything.
Yeah, that's really great. Also, telling your friends or your neighbors or your child's friends, it's important that she or he eat this or not eat this, and encouraging your children to have conversations with their friends too. So it keeps you accountable and helps the adjustment process too. So that's really great. Planning it out, being prepared, and just really advocating for yourself when you go to a restaurant, and let them know, like, they really cannot have this and this. Please be very careful. Don't be afraid to ask them to clean things, change their gloves. It's very important. Anything else? These are good questions,
Our daughter is 3. She was diagnosed at 2.5. Does anyone else have any youngers? See, we're not the only one. So we started off with gluten-free. Okay. I don't know if it works or not yet. We'll see, maybe or maybe not. But for her, it's been pretty easy because she is so young. It's matter of fact. Mm-hmm. And it's sweet to hear her little voice. Is it gluten-free? Oh. It's just sweet. But what I did learn with her, especially when she was hunger roiding, is to have a yes drawer in my refrigerator that she can always go to, and I never tell her no. Whether it be cheese sticks or oranges or, just those things that she can always just fill her stomach with. And I think even with the snacks, I'm trying to find her fun snacks that are, I love that we live in the DFW area, so we have access to so much gluten-free, yummy things that look the same. Mm-hmm. If we have donuts, she can have a donut. And so that's exciting for her. But the yes drawer was the most yay, she was happy. Drawer.
I like that. I'm going to write that down and start using that. Good one.
For some of you others that have the little ones, any other challenges for that age group specifically? That's a pretty intense age group when it comes to food and mealtime.
He was so tiny. He wasn't an eater. 2 days into the oral steroids, he was, got any chips, Mom? All he wanted was chips. Everything was sodium. It was so, do you remember that? Oh my gosh, he ballooned up so fast. And they always said, keep him away from the sodium. So that was hard for us, but because he was that age, all we had to do was clean it out of the house, and he had no choice but to eat what I put in front of him. It's when they get older, it gets harder. So I actually think it was a good thing that I think it's easier when they're diagnosed younger. It's easier to manage as a parent. I think it'd be harder now if he was getting diagnosed at 5.
I like the yes drawer. I'm really digging that. Good job.
Our son Mateo is 4, and he was diagnosed last October, and he lost his appetite. Mm-hmm. So he was a great eater, and all our kids are pretty much good eaters. And so we just started trying to give him more of what he liked, just so that he could get the calories in. But our daughter, who does not have myositis, had severe eczema. And although we had her tested for, 20 or 30 different allergies, that test they do on the back.
Oh, yeah.
We were certain she was going to test positive for a corn syrup allergy, and she didn't. And but nevertheless, this is where truth meets science. Our allergist, who we respect very much, made a very bold statement to us that if it was up to him, he would ban corn syrup and all corn syrup derivatives from food processing, from food products. Mm-hmm. And so we've tried to, if you look at the derivatives of corn syrup, it's probably 100 or more. So, it's virtually impossible. You'll be quickly disappointed when you go through the grocery store to try and eliminate those completely. But if it's, usually the general rule of thumb is if that item that you're looking for eliminating or reducing in your child's diet is in the top 3, top 4 of the ingredients, then maybe that's something you should try and look for an alternative on. Mm-hmm. But it's weird because all the parents that I've spoken to today said that a lot of their children, because of the steroids, put on sometimes massive amounts of weight. Yeah. And in our case, at present, we're very new to the disease and the experience and the journey. But Mateo has really thinned out, and so we're just trying to keep his weight up and doing the smoothies, doing some alternative things.
Yeah, that's great. If you think about it, the things that have corn syrup in there are generally pretty bad for you. So candy, Cokes, things like that. But it isn't a lot of things. So if you truly do have a corn or corn syrup allergy, you're basically going to have to go paleo or some sort of version of that. But occasionally we do have a kiddo that's underweight. So making sure you eat regularly. I usually have my patients set a timer. So eating every 2.5, 3 hours, even if it's just a little something, or drinking smoothies. A lot of times it's easier to get kiddos to drink their calories versus eating. Because if you don't feel well, then I don't want to eat when I don't feel well. So, but great job. They go on food jags. That happens too. So just whatever you need to do, the time being.
I do have one question.
Sure.
It's related to photosensitivity. So I don't know.
I'll do my best.
Okay. Because we started with our older daughter having a lot of eczema at an early age, we became familiar with a wide variety of different creams and topical ointments, depending on how severe the eczema was, from stuff that you just put on after the shower to making sure they stay damp when you do that, all the way to using medicated creams when the skin broke and things of that nature. Mm-hmm. With respect to our son and being photosensitive, very photosensitive to light, we understand, using the maximum allowable sunblock. Are there any other tricks? We learned today that chlorine might be a trigger, which is something we hadn't really thought about. But our son just got out of the pool about an hour ago, and he was beet red, and we were like, bingo. Mm-hmm. So trial and error. Yeah. But anyways, are there any pointers in terms of photosensitivity that you could offer to us? Or any other parents here?
I don't know if anybody, the only things that I can think of is, probably all the things that you can think of: hat, long sleeves, those like little wetsuit type of things if you're going to go swimming. It could be, as far as your daughter's skin thing, it could be, environmental. Texas, Austin's really humid, so if you live in Colorado where there's no humidity, you're going to have to work harder to keep your skin moist. But I can't really think of anything other than long sleeves or maximum. They probably do.
Dr. Kim was at Boston Children's, and we went to see her for a while. I think she's in San Francisco now. But anyway, we had tried so many different sunblocks, none of them worked. She told me to use Neutrogena Pure and Free Baby, the stick zinc oxide. Oh my gosh, it fixed it. None of the other blocks worked. So we put the actual stick on his face, and then we used the lotion. The stick has a higher zinc oxide. The amount of zinc oxide is more than the lotion. But then we do the lotion on his arms and legs. Neutrogena Pure and Free Baby. And the stick for the face and the lotion for the arms. But nothing worked, and that worked great. So I can't remember the percentage of zinc oxide in it. But it's a pink and white bottle. It's the only one they have. Target has it. And we've gone anywhere we've been in the country, we will run and grab it, and they've always had it in Target. So that definitely worked for us. One other thing.
Oh, Neutrogena Ultra Sheer, and it's a spray, and they have it in 100. It's really light, so if their skin is having issues, or if like even rubbing on it hurts, which Kai would say her skin hurt when she was 2 and was diagnosed, she'd say that hurts me. And so we started using the spray, and we've used it forever. She's extremely light sensitive. We have our car windows double tinted to keep it out. She gets, like you said, red underneath the UV. So we put that sunscreen on her every day, and she does it even on herself in the spray she can on her face and stuff. But it works really well, and they also have a sweat-proof and waterproof one in the Neutrogena, and it works. I will tell you, though, in the summer, because, you spray down their scalp and everything, if they are going to have their hat off, they won't sweat through it either. So you have to be careful about overheating, because if they can't sweat through it, they will overheat. And we did have that happen. But with her sensitivity, and then also we had to completely avoid 10 o'clock to 2 o'clock outside at all costs, not even an option. And so she learned to tell time pretty quickly. But, 10 to 2 at all costs, especially in Oklahoma. And as it got summertime, even 10 to 4, 10 to 5 because of the UV rays. Yeah. And there is UV awareness. They have a website, and you can put in your zip code or your address, and it will tell you what the UVs are by the hour where you're at. So even if you go on vacation, and there's also other apps, but I know UV Awareness has one on their website. So
there is a session right after this on managing sun exposure. So this would be great tips to share with everyone. I know, I love it. I love it. That's great.
I don't know. I learned things. Thanks, guys.
Has anyone had any issues with laundry detergent that they're using? Okay. Because I was wondering in terms of, I know that just to kind of draw on what we've been talking about, there was a question earlier about gluten sensitivity versus a gluten allergy, and I know that the research doesn't really support that concept right now, right? That you're either allergic to something or you're not. But I think most of us have sort of seen that maybe there is a kind of a sliding scale where, because the immune system is out of whack, that maybe things which wouldn't normally affect them if their immune system is working, let's say, at a 10, if 10 is normal, but it's overworking, so maybe it's like at an 18, as opposed to a 10. We need to get it back to a 10, and as soon as it's back at a 10, then some of that stuff doesn't really matter anymore. So I guess I'm just sort of wondering if, like, for instance, the chlorine issue, if maybe once the immune system gets back and okay, that the chlorine won't be an issue, because I think that was your experience, right? Okay.
There's gluten in some detergents. It's in toothpastes, it's in lotions, it's in shampoos. I have one patient that's allergic, like topically, to gluten. It's in a lot of things. I think the Tom's brand of toothpaste is gluten-free. Soaps, it's in like lotions, soaps, things like that. So it's in a lot of things. I would recommend, if you're questioning your detergent, it's probably either the fragrance or gluten. So, which probably the Neutrogena stuff is super hypoallergenic. That's probably not scented. So it's really easy on your skin. Yeah.
Kaya reacted to chlorine while she was in her flare. since then, but she only reacted to it in public pools, which have a lot of chlorine.
Right.
We have a pool at home that doesn't have much. She was fine, but you put her in a public pool, open, and extreme reactions, but only during that time. She's fine in them now. So, but definitely she developed an adhesive reaction. She developed laundry detergent reaction, chlorine, and sensitivity. I've never tried the sunscreen again, or never tried the laundry detergent again. We're definitely one kind now, but she did develop several of those. We're trying to wean back into seeing if we can use adhesives and things, but definitely did develop them through that time of being. And like you said, their body is out of its normal, and so a lot of those did develop during that time.
Yeah.
So back to the sun exposure, we found a laundry treatment, RIT, R-I-T, and you could treat your clothes in it, and it will provide, through 20 washes, it'll block out UV rays. And I wash all of my daughter's clothes in that, and every few washes I just pre-treat it, because a lot of the UV rays goes through your clothes too.
This goes maybe for some of those with younger kids, and this is actually a physical therapy kind of question. What about toe walking? Has that been an issue for most of you? Okay, because our doctor, who's great and who's done fantastic and all that, doesn't necessarily associate that. She's just said, well, that's just a little kid thing or whatever, and we're like, no, for us, it's always seems to be. Okay, go ahead, you talk.
How old is your toe walker?
Well, she's 6, but she's had issues with toe walking, as long as she's been walking.
Okay. There are lots of different things that can be toe walking. This can be a totally separate issue. It can be related to a myositis, but it can also be toe walking without any other disease going on. Sometimes kids can go up on their toes as you're actually, it sounds crazy, but you can be more stable up on your toes. It locks out the ankle joint. Kids with, Duchenne's muscular dystrophy, they'll go up on their toes too. But it's part of a weakness thing. It can also be a sensory thing. It can also be that you've been up on them so long that now we have an ankle contracture issue going on. So if you have anyone over the age of 2 who is toe walking consistently, therapy and treatment is go, do it. Under 2, if I get a toe walker to me, I'm like, all right, let's see where this is headed, see why, and see if we can nip this in the bud. But anyone over 2, I'm definitely, first of all, assessing sensory, second, assessing contracture, and then I'd assess strength for your little one too. And if you have any specific questions, we can chat afterwards. Yes.
Hi, I'm curious about people that have, they're trying an alternative diet like clean eating or dairy-free or gluten-free. How soon after you've changed your diet have you seen improvement or changes or, some specific benefits?
So we did a whole elimination diet where you take every possible allergen or irritant out of your diet for 2 weeks, let your gut heal, and then individually add one back in at a time. And so within those 2 weeks of taking everything out, she was better. And then we would add one thing in, and I did it with her. And I apparently am allergic to nothing. So it was 3 months of not eating what I wanted. But anyway, as soon as we would add anything dairy or any dairy, and there's 4 different ways to reintroduce dairy. There's the yogurt versus the milk versus the cheese. They're all separate. Any of them, within a day or 2, all of her symptoms would come back. So it was pretty quickly identifiable.
Just a comment on the sensitivity with different things. I think especially with our younger kids, looking at how they eat, and younger kids often have a very high dairy diet. They love their milk, they love their sippy cups, and they want to walk around with their sippy cups all day. They love their string cheese. They love their little Go-Gurts and their Danimals. And so if we look at a lot of toddlers' diets, the dairy is very unbalanced. And so with regard to the sensitivities, there may not be an allergy that is an immune response. That's the definition of the allergy, is that it's an immune response from your body. But there very likely may be something out of balance in the diet, or something that just needs to be a little altered. And it might not be a complete exclusion of dairy or a complete exclusion of gluten, which is another ingredient in our diets that is very high in our American diets. It could be just by bringing these things down to a moderate level that we'll see a really nice improvement in our health. And I mean, even with healthy people, if we're not used to eating a lot of gluten, let's say, and all of a sudden we go on a carb binge, we might not feel as good as we normally do. If we're not used to eating a high-fat diet and all of a sudden we eat a double bacon cheeseburger, we're probably not going to feel too good. Am I sensitive to that food? I don't know. But there are certainly foods that make us feel better than others.
One last thing, I guess a lot of you guys have young ones who are just starting it, and Kaya was too when she was diagnosed. She was actually diagnosed less than 2 months after she turned 2. And whenever you were talking about eliminating them or letting them limit their time, playing time and stuff, of course we did that with her. One thing, however, as they grow up, as we experienced in kindergarten, is she learned to limit herself from things she didn't want to do. So she limited herself from PE for about a semester, because she told the coach that she didn't want to do that, or her legs were tired, or her knees would hurt. And in all reality, she was perfectly fine and just did not want to do anything. So they learn the system very quickly, especially starting at the age of 2. Yes, it's easier because they're little and that's all they've lived with. But also, they do learn the system. And so it's really hard to truly say, how do you feel? Because they've learned when you say, how do you feel, that's what they're going to have to do for the rest of the day, or that's what they're going to have to eat, or that's what. So just as a word of advice from a mom who's been there and who had a child laying in the ER one night saying they need her appendix out, and she tricked the med student who came in by saying, no, that doesn't hurt, that doesn't hurt. And the minute he walks out, she looks at her grandma and says, I tricked him, didn't I? So when we did the full x-ray and we ended up being there for a procedure, they realized that they learned the system. And so that is one thing also with everything is, we want to let them kind of take control too, but you also have to remember that they also learn that. So they learn to limit themselves to whatever you allow them to limit themselves to, or they learn how to use that in their benefit too. So just being there from 2 to now she's 10, I've kind of been through that whole age range. So the food thing, the exercise thing, the PT, the toe walking, we did toe walking. Hers was sensory. She put a pair of socks on her and she was fine. Didn't have socks on her, she wasn't fine. And so we've been through it all, and now she doesn't toe walk at all because she's older, and she probably did it till she was 4 or 5, but their concern was the movement of everything else because she had lost her torso muscles. So there's many things. They can do anything they want to do, but they will also learn that, so they can do anything they want to do. So self-limiting, sometimes they will learn to do that also.
Jack, as soon as we cut out those processed foods, it stopped immediately because he would break out in hives on his face. But then there was still obviously another issue. This was before he was diagnosed. So we cut that out, and then the sun started. Every time he was out in the sun, he'd flare. But there was it immediately got better when we cut out those foods. We're not so good with it anymore. Now that he doesn't react, we let him eat those foods. But it made a difference for us. It just didn't fix the problem. And there was still a problem there, but it helped with the hives. So weird. It was so weird that he broke out in those hives.
We know we got some younger kids. What are some of the ages of the older? We've got 10, 14, 11. Okay, who else? 7, okay. And then you guys are younger, 6, okay. 14. Those of you with older kids, teenagers, looking back, with your wisdom in terms of whether it's nutrition, things that you've done over the years, are there things that you would encourage, or are there things, maybe decisions or things that you've done that you would warn against doing?
We had a little issue, and my daughter's, she's bigger, she's been on steroids for probably 7 years, and she's monthly getting, steroid infusions, and every reward we did, which is our fault, was food. When we came back from the thing, let's go get, food here, and I find now it's harder. We're working, through her counselor, but it's something that we've done. We've created this monster, and that's all now she talks about is, food. Where are we going to go after I have my treatment? And then even at the airport last night, we went past some food place. She's like, there's all health food here. I'm like, okay, and I know it's us, and we're trying to get through this now. And it's been a hard thing for my husband and I because we don't want to constantly be on her, for food because she's got all these other issues that she's dealing with now. But it does affect her in the long run, but it is a hard thing, and it is a monster that we've created, and we know that. But I don't want to lower her self-esteem even more by constantly being on her. I tried to take her to Weight Watchers. She's like, are you kidding? Aww. You take me to Weight Watchers with all these old people? So that hasn't been really good.
Yeah. So, you hit the nail on the head. So, once you start doing that or once you start rewarding with something like that, I generally try to do bless you, like a movie, like everybody go to a movie or everybody go do something else or go bowling or main event or some type of thing like that as a reward. Or maybe go buy something like clothes or shoes or something. Maybe not shoes every month, but that'd be sweet. So something like that, a non-food reward. So that you can get in big trouble real quick with food rewards, especially if you're going, every 4 or 6 weeks to an infusion or, to the doctor or something like that. So non-food rewards, that's good. It's hard to get out of that habit and that cycle too. So, iPad movies, yes, that's good. Yeah, desperate times, but hopefully not a reoccurring thing. It's good.
You mentioned the CMAS test, and I believe you mentioned it. Does everyone understand what that is? Could you discuss the CMAS a little bit more, and then maybe also for the audience, if they don't know what it is, how they could ask for it and what resources? How do you approach a doctor about that if it hasn't been done yet?
So I think we had asked before if we could get it, and it is, if you Google CMAS, it pops up for you. So I have the sheet. It looks like this. Very simple. It goes through, if you're laying down on your back, how long can you hold your head up off the mat? And it tests how long you can do that. So testing these neck flexors. And then it asks how long you can hold your leg up, laying on your back again, how long you can raise your leg up, again, testing some proximal muscles. It does rolling over, testing your core muscles. It basically goes through the list of, can you do sit-ups? Can you get up from laying down? Can you, so there's the arm raise one up over your head. How long can you hold your arms up there? And then can you sit up from the floor? Can you be on your hands and knees? Can you stand up from the floor? Standing up from a chair, stepping up on a stool like stairs, and then bending over to pick something up off the ground. And it just goes through a list and it gives you a score of whether you can't do it, and then anywhere in between being you're perfect at it you can't do it, or anywhere in between. It has different points for each thing. And then as we progress and go through treatment, you've got your inflammation under control, you're no longer in a flare, retest and see where you are then. And it's just something that you can continue testing with. There are some limitations. I was recently reading about, like, there were some points, and I don't recall which ones they all were, but like 4-year-olds didn't test perfect on all of them, the sit-up one. And that one, because it's like, they can't do sit-ups with their hands behind their head without help. That's 4-year-olds. That's not age appropriate for a 4-year-old. So there are a couple things that aren't completely age appropriate, but if they're getting a good score on everything else but one thing, you're doing well. But it is readily available if you Google it. It's not one of these tests that you have to pay money for. But it is a standardized test for this population.
We were told that so when my son was 3, we went to NIH to do a research study, and that was the only time we've ever met with a physical therapist. And they gave me a few exercises to do with him. He couldn't do a crab walk.
It's a hard one.
At what age is it normal to do the inverted crawl?
I'm trying to think. My 2.5-year-old could do a crab walk.
Okay, so I didn't know if that was abnormal, he couldn't do it, or...
I wouldn't ask a 1-year-old to do it. Yeah. But around 2.5, we could start practicing it.
He can do it now, but he can't do it long. He can take like 1 or 2, maybe 3 steps, and his butt falls. So I don't know if it's something we should keep practicing, if that still means he's a little weak there.
Absolutely. Crab walk is a good core strength one. Core and arms and legs, that's a great endurance, core, everything. I've got 10-year-olds that are deconditioned that can't do a crab walk. Like, that's just a good. Animal walks in general for little ones are good. Crab walk, bear walk, frog jumps are really good.
So at 5, am I being, crazy mom to like expect him to be able? A 5-year-old should be able to do this pretty well at his age.
Yeah.
Okay.
I mean, I think back to when I was in elementary school. If anybody played crab soccer in elementary school, no. Yes,
no, but
I see a few head nods. Yeah.
It sounds fun, actually.
It is. Those are things like with the younger ones, incorporating fun activities like that into your exercises. Having 30 minutes of the weekend is exercise, therapy time or something, and so you're getting some good focused exercise. But otherwise, younger ones, going to the park and playing is going to be good exercise for them.
Sorry, this is another nutrition question. So along the lines of the CMAS test, is there a test or whatever that we should be doing for our children? Do we just take them to a dietitian and then they'll test nutrients levels, or how does that work? I mean, how would we find out nutrient deficiencies?
It's something that your doctor should pull, like labs, every appointment, or that's what my doctor does. And they'll pull, if they're on steroids, vitamin D, calcium, sometimes phosphorus, potassium, things like that. So that's, as far as laboratory work, that's what they'd pull, and that's what a doctor would normally do. I mean, I wouldn't necessarily pull anything other than that. But things that I look at are anthropometrics, like weight, height, BMI, for littler kids, head circumference. So that's what I look at, and then in addition to the lab work. But it's mostly vitamin D, calcium, and a few other electrolytes because of steroids. Oh, yeah, the lipid panels. Right. Right. Yeah, lipid panels too. Yeah, which, I mean, they should be getting, labs pulled annually for just general checkups, well child checks.
The question is, what about
like supplements, like taking vitamins? I generally don't like to, I mean, you can. There's nothing wrong with taking vitamins, especially if you're deficient. We do recommend those for some kiddos. But if you're eating a general healthy diet, you know, without a lot of restrictions, there's no need. If they're super restricted or really picky or deficient, obviously, yes. Too much of a good thing can be bad. So sometimes you'll just pee it out and have really expensive pee, but sorry, we're live streaming, yeah. And so sometimes, but it can cause, sometimes, I mean, it can cause problems. Sometimes too many. Yeah. Good questions. Anybody else? We have a few more minutes, I think.
I'm curious if any of what are the standard recommendations for the doctors? Do they have your kids on calcium, vitamin D, iron if they're low?
Yeah. Dr. Putman put Kai on that from the start, and that is one thing that even out of remission she stays on, because without the calcium and the vitamin D, her level falls too low because they do have absorption issues, usually the kids do, and so she still takes a multi-daily. She takes calcium. Her Dex skin, she's still pulling them, and one of hers was a little lower. So those are continued effects from all the steroids and all the different things. So if they're not pulling calcium, vitamin D, I would definitely recommend that, because still we've been in remission 4 years, 4 years, and we're still dealing with daily. I mean, she takes omega-3s, yeah. She takes the multivitamins, she takes calcium, and she takes D every day, and she takes several of each just to keep her levels in the normal range. And so if they're not, definitely have them check those, because like I said, even in remission, she has to keep them regulated. So
and sometimes, like the B vitamins, folic acid, B6, B12, things like that. Those are all related to gut health, absorbed in your gut. And so, you know, if you're having those types of issues, you might have a problem absorbing. So, yes. Methotrexate jocks with your, inhibits. It inhibits your absorption of folic acid. So, yeah. Good.
You seem like the, natural type of person. So I'm okay. I'm half Doritos, half kombucha. Like I'm really trying hard to be very natural. We buy a lot of organic fruits and vegetables. We're always organic milk, trying to go non-GMO. Yet I raid the Valentine's Day candy and eat Doritos. So I try to do both, and I'm trying very hard. It's just a lifelong thing. But recently I am brewing kombucha, and I'm making fermented veggies. And I heard for Bradley, I don't know that he can have probiotics, and we were always told theoretically they should not have probiotics. But he has a lot of stomach problems, and now that I'm making these fermented veggies, I'm wondering if I give him a little piece of that from time to time. Does anybody do that? Or does anyone give the kombucha tea or anything like that? Fermented foods? He's 10. Yeah? You think so? Okay. Right.
It should be fine. Does he have diarrhea?
Yeah, he has both constipation, diarrhea, upset stomach, nausea, vomiting all the time. Just a lot of stomach problems in general.
Is he on antibiotics, or was he? No.
He's on all the JM medications.
Okay.
So.
Yeah. Particularly antibiotics do it because they knock out all the good and bad bacteria. So kefir is really good, yogurts, kombucha.
But then last year somebody said something, I want to say it was in this nutrition forum, that probiotics are bacteria, and theoretically they're immunocompromised, and maybe they shouldn't, So I'm believing that all of these things are great, but then
It's probably not something that I would recommend in the middle of a flare or for a cancer patient who's immunosuppressed. So maybe when he's feeling a little bit better, you can try doing that, or you can try doing things like yogurt or kefir that, if I remember correctly, how you make kombucha, it's not like pasteurized or anything like that. So it could just be, or it might be a little too much bacteria.
There's a
well, the SCOBY thing is freaky. It's a weird thing. I kind of freak out when I drink it. And I'm an adult. But yeah, so it could just be a little bit too much. You could try doing something a little less intense, like yogurt or kefir or something like that. Or you can always, I don't know if your son sees a GI, could potentially see one of those and see if there's anything else going on gut-wise.
I do just want to respond to that. So we had intermittent nausea all the time. She would be mortified that I'm sharing all of that. You know, she's 14. I know, on the internet. Oh my gosh. But she had constant constipation issues and nausea, and was on Miralax every day, and just trying to balance all that. That was one of the, and she's had heartburn pretty much since birth. So those were some of the issues I was hoping a naturopath could help with, because I was sick of giving her drugs and chemicals. And so we got her off of the Miralax and off of all of her, every drug that she's ever had for heartburn, by giving her magnesium and iron. And so the iron helps with her energy, and the magnesium helps with her bowels. And she's been completely normal. And I can give her one pill versus two depending on the day, but it's magnesium, so it's an element, and she's got no more all of her GI problems are gone. So again, that was under the naturopath's care, who was told, communicate with the rheumatologist, be a team player, and and they are, and so we're not doing anything too risky depending on what her state of health is, but it's been amazing and so freeing to find solutions to this and not have to struggle with it on a daily basis.
Yeah, that's good.
We didn't take anything out of the diet, but we did add some fiber, and like I said, the multivitamin. She was on the magnesium and stuff. So with those balancing, but we did end up in Chicago in Children's Hospital for a week with a feeding tube, even because everything got impacted, which causes the vomiting. Because they turn septic, they turn toxic. I mean, it does happen. They said that's part of it. Kind of, they develop a sluggish intestine from all the medications, and afterwards they can start having those issues. We went through it all. She did the Miralax and everything for about 1.5 years, got things normaled out, then took her off. But with the balance of the vitamins, which is what we still have to do, and the fish oil even helps with that. The DHA, it's like a junior strawberry one. She likes them.
Strawberry.
They even smell good. They
really?
smell good.
Oh, that's good.
And
that's
so,
rare.
I mean,
what brand is that? I need to recommend that.
DHA Junior.
DHA Junior.
And they're strawberry, and little kids can even take them and chew them, and they don't taste bad. But they're only like little bitty round
little
pearls.
bitty. Oh, that's so good.
Yes, and they're made for kids, and they're no omega.
Usually they're like horse pills.
Right. They're burpless one too, so they don't get that grossness.
That's important.
They don't get the grossness afterwards.
That's
so
nauseating.
With a bad stomach like they had, having those weren't good. But we went through the same stuff. They said it is jam related after kind of sort of develops later, and so we didn't take anything out of the diet, but we did continue the multivitamins, and that kind of seems to work with the different things there.
So Melinda has suffered from severe reflux to the point where she can't sleep, and she needs to sleep with 5 pills. We've used Pepcid, but I've tried to take away like spaghetti sauce and any like with acidic fruits and foods. Mm-hmm. Is there anything else you could recommend?
Besides removing food? When you're sleeping upright, does she eat really quick?
No, she's a slow eater. She eats frequent meals, and we try not to feed her after like 6 p.m.
Yeah.
because then when she goes to sleep, it still comes up. It's a little bit controlled with her Pepcid now, but we still have episodes where she wakes up and she's choking.
Yeah. So small frequent meals, which you're doing. I mean, things like pineapple, tomatoes, lemon, obviously. I feel like you're doing most everything. Is she just on Pepcid?
She's just on Pepcid right now.
Has she tried anything else?
No, we were going to discuss this at her appointment next week.
Okay, they either need to change it or cocktail.
That's
her. Yeah. I have some kiddos that are on 2 different kinds, unfortunately. Or maybe up her dose or something. If you're doing everything else.
We have just about 5 minutes left if there's any other thoughts going on in your head or questions for Stephanie or Shelley. Words of wisdom or experiences that you can share with each other. We'd love to hear those.
Kaya loves practicing for the CMAS test. She's crazy, but once they do it and like they know what they have to accomplish and what they're expected to do, like she would say, "Time me, see how long I can hold my hands up," or how. And doing sit-ups, like that was her biggest challenge because that was what was not age appropriate, and we knew that. But that became her challenge as to every night trying to do sit-ups, which of course only helps them get better. And she would make us all try to do sit-ups and try to do them all. And so it is good that they can do that. It works for them, and they do kind of develop it as a game, and it's a fun, because they time them when they're doing this. It's not just can you hold your hands up, it's can you hold them up for 90 seconds or 2 minutes, or can you hold your neck up for 90 seconds? And so it becomes a good game for them. It becomes a strengthening thing for them. It becomes a challenge for them. So I will just say that Kaya, that's still even, she was doing sit-ups this week going, am I going to be able to do them for, because she got it at 2, she's 10, and she just got a perfect CMAS score last year. So they're definitely, of course it was very aggressive, and she did lose a lot of muscling and went through a lot, but it does take a while to get those back. Those core muscles, even when you think you're doing good and in remission, it takes a while to get all those core muscles back that they're looking at to get that perfect score. So you might think bending over to get a pencil, but it's how they bend over. Do they bend sideways? Do they just bend straight down? Can they pick it up? Do they, how do they step up and down? How do they get up off the floor? Do they use their hands? So there's a lot more to it than just plain and simple, but it becomes a challenge to them too, and something that they can accomplish. So, and it does sometimes take a while. So if they get a bad CMAS score, don't go, oh my goodness, but it does give you something to look at and build on and see where they do need to be strengthened. Even after remission, it takes a while.
For those of you not having experience with the CMAS test, there is a video out there that you can watch that shows a child going through the CMAS test. Do you know if you can still Google it or YouTube? Maybe we could try. Videoing your own child, yeah. If you go to a visit. But it's useful to learn because it can be used at home by the parent. If they have been raising their hands above their head pretty well, and then all of a sudden they're not. If they're not wanting to blow dry their hair or brush their hair, and you start to suspect something, you could have them do that part of the CMAS test or do as much as you feel comfortable doing at home, and it could give you some information to share with the doctor. Anyone else? Well, thank you for sharing. Thank you for putting yourselves out there and sharing your stories. And thank you, Stephanie and Shelley.